The focus of the clinical framework is on physicians across therapeutic areas and how they believe genetics and molecular diagnostics have already had a major influence on their work, but admit their knowledge about these subjects is insufficient. The Get Informed level looks at why awareness alone does little to promote personalized medicine and diagnostic use. It also examines the barriers that impact diagnostic use in clinical practice and discusses how to remove these, and how clinical data and continuing education for physicians are necessary to guide or support the use of a therapy or diagnostic test. The Get Planning level has practical guidance, such as work streams and critical actions, plus an essential diagnostic launch kit. Evidence shows that a number of potential barriers and obstacles can slow down physicians' adoption of novel diagnostics. One key barrier is that physicians across specialties lack the appropriate knowledge around diagnostic testing and the confidence that comes with such understanding. When launching novel diagnostics, pharmaceutical and diagnostic companies have opportunities to effectively address many of the physicians' adoption barriers. The goal here is to understand that awareness alone does little to promote personalized medicine, and it is education for physicians that is needed to guide or support the use of a therapy or diagnostic. So, the objectives for the clinical framework are to show which common barriers and obstacles exist to slow down physicians' adoption of novel diagnostics, to discuss the initiatives pharmaceutical and diagnostic companies can take to remove these barriers, to illustrate how perceptions of complexity around a test can be a critical factor in a clinical setting, not just for the physician, but for administration teams and, ultimately, patient confidence. And finally, to highlight the importance of articulating clear and endorsed clinical utility for testing in the guidelines.